Dr. Jonathan Michaels had been practicing medicine for over 20 years. He was known throughout the small town of Cedar Creek as a skilled and compassionate doctor who went above and beyond for his patients. He had seen just about everything in his long career, from broken bones to terminal illnesses, but nothing could have prepared him for the events that were about to unfold. It was a typical Tuesday afternoon at the Cedar Creek Medical Center. Dr. Michaels was finishing up his last appointment of the day, a routine checkup with one of his regular patients, Mr. Jameson. Mr. Jameson had been coming to see Dr. Michaels for years, ever since he was diagnosed with high blood pressure. He was a quiet, unassuming man in his early 60s, who always kept to himself during their appointments. As Dr. Michaels was finishing up the checkup, Mr. Jameson suddenly lunged at him with a pair of scissors he had hidden in his pocket. Dr. Michaels tried to dodge out of the way, but Mr. Jameson was too quick. The scissors sliced through Dr. Michaels' lab coat and cut into his shoulder. Dr. Michaels stumbled back, his hand pressed to the wound. He couldn't believe what had just happened. He had never been attacked by a patient before. Mr. Jameson continued to come at him, swinging the scissors wildly. Dr. Michaels was able to back away and grab a medical tray to defend himself. He knew he needed to stay calm and think quickly. He tried to reason with Mr. Jameson, to no avail. The man seemed to be in a rage, his eyes wild with anger. Dr. Michaels knew he had to take action. He grabbed his phone and dialed 911, trying to keep Mr. Jameson at bay with the medical tray. But the man was relentless, continuing to swing the scissors in a frenzy. It seemed like hours before the police and paramedics arrived, though in reality it had only been minutes. By that point, Dr. Michaels had managed to subdue Mr. Jameson with the help of a nurse who had come to investigate the commotion. The police took Mr. Jameson away in handcuffs, while the paramedics tended to Dr. Michaels' injuries. Dr. Michaels was rushed to the hospital, where he underwent surgery to repair the damage done to his shoulder. The wound was deep, and he would need months of physical therapy to regain full use of his arm. But the physical injuries were nothing compared to the emotional trauma he had endured. For weeks after the attack, Dr. Michaels was plagued by nightmares. He began to avoid seeing patients altogether, preferring to stay in his office and pore over medical journals. It wasn't until he started seeing a therapist that Dr. Michaels began to feel like himself again. The therapist helped him work through the trauma of the attack and taught him coping mechanisms for dealing with anxiety and stress. Slowly but surely, Dr. Michaels started to feel more confident in his abilities as a doctor. Despite everything he had been through, Dr. Michaels refused to let the attack define him. He returned to work at the Cedar Creek Medical Center, determined to not let fear keep him from doing what he loved. The support of his colleagues and patients helped him to stay strong, and he even started seeing a few new patients. Years went by, and the memory of the attack began to fade. Dr. Michaels continued to practice medicine, helping countless patients in the small town of Cedar Creek. He never forgot what had happened, but he refused to let it hold him back. Then, one day, something strange happened. Dr. Michaels was in his office, finishing up some paperwork, when there was a knock at the door. He looked up to see a man standing in the doorway, looking nervous and unsure. The man was tall and thin, with graying hair and a weathered face. He looked vaguely familiar, but Dr. Michaels couldn't quite place him. "Can I help you?" Dr. Michaels asked. The man cleared his throat. "I'm sorry to bother you, Dr. Michaels. I don't know if you remember me. My name is Jameson. I was your patient many years ago." Dr. Michaels felt a chill run down his spine. Of course, he remembered Mr. Jameson. How could he forget? But he tried to keep his composure, masking the fear he felt inside. "I remember you, Mr. Jameson," Dr. Michaels said calmly. "What can I do for you?" Mr. Jameson shifted uncomfortably. "I wanted to apologize, Dr. Michaels, for what I did to you all those years ago. I was in a bad place, mentally. I was struggling with some personal issues, and I took it out on you. I know that's no excuse, but I just wanted you to know that I'm sorry." Dr. Michaels listened, surprised by the man's words. He had never expected an apology, and he wasn't sure how to react. "I appreciate your apology, Mr. Jameson," Dr. Michaels said finally. "But I think it's important for both of us to move on from what happened. It was a difficult time for me, but I've worked hard to overcome it. I hope you've been able to move forward as well." Mr. Jameson nodded. "I have, in my own way, but I always felt like I owed you an apology. I just wanted to make things right, if I could." Dr. Michaels smiled, feeling a weight lifted from his shoulders. "I appreciate that, Mr. Jameson. Thank you for coming to see me." As Mr. Jameson turned to leave, Dr. Michaels couldn't help but feel a sense of closure. It wasn't often that people took responsibility for their actions, let alone apologized for them. But in that moment, Dr. Michaels felt like he could finally put the attack behind him and move on with his life. From that day forward, Dr. Michaels continued to practice medicine in Cedar Creek, never forgetting the lessons he had learned from the attack. He remained vigilant and cautious with his patients, but he also learned to trust again, both himself and the people he served. And he knew that no matter what challenges lay ahead, he would always have the strength and resilience to overcome them. Despite the closure that Mr. Jameson's apology brought him, Dr. Michaels couldn't shake the feeling of unease that lingered in the back of his mind. He knew that Mr. Jameson's mental health had been a contributing factor in the attack, but he couldn't help but wonder if there were other patients out there who were struggling with similar issues. Over the next few weeks, Dr. Michaels started to notice subtle changes in his behavior. He found himself locking his office door more frequently and double-checking that his security system was functioning properly. He was also more cautious around patients, especially those who exhibited signs of aggression or instability. It wasn't long before his fears were realized. One afternoon, while Dr. Michaels was in the middle of a routine checkup with a patient named Mark, the man suddenly lunged at him with a sharp object. Dr. Michaels barely had time to react, but his instincts kicked in and he managed to dodge the attack. He pushed Mark away and quickly hit the emergency alarm button on his desk, calling for help. Within minutes, the police arrived on the scene and subdued Mark, who was eventually diagnosed with severe schizophrenia. Dr. Michaels was unharmed physically, but the attack left him shaken and traumatized. He knew that he couldn't continue to practice medicine under these conditions, and he started to seriously consider retiring from his career. But something inside of him refused to give up. He had worked too hard to get where he was, and he wasn't about to let a few bad experiences rob him of his passion for medicine. Instead, he sought out therapy and counseling to help him work through his trauma, and he also started to look into ways to increase his safety and security. He installed new security cameras and alarm systems in his office, and he made a point to always have a nurse or assistant present during exams. He also started to work closely with law enforcement, sharing his experiences and insights in hopes of preventing future attacks on medical professionals. As time passed, Dr. Michaels found that his efforts paid off. He was able to continue practicing medicine, and he even started to feel more confident and secure in his work. He still remained cautious around patients, but he also learned to trust his instincts and judgment, knowing that he had the skills and knowledge to handle any situation that arose. Years went by, and Dr. Michaels became a respected and trusted member of the medical community in Cedar Creek. He continued to help patients, both mentally and physically, and he never forgot the lessons he had learned from his own experiences. He even started to mentor younger doctors, passing on his knowledge and expertise to the next generation. And while he never forgot the attack that had nearly ended his career, he also never let it define him. Instead, he used it as a catalyst for change and growth, becoming a stronger and more resilient person as a result. In the end, Dr. Michaels proved that even in the face of adversity, hope and healing are always possible.